Okay. Again, good evening and welcome to the course. I'm very happy and thrilled to see, such a big strength in the weekly courses, right? Because it is only a week long course. I'm really happy to see all of you are joining and, taking part into this emerging topics, right? And I want to take few minutes to explain that what this course is all about and why, why is very important, why this laboratory medicine is extremely, becoming important for you as future healthcare professionals, because I want you to be able to understand that why we are studying this. Okay. I experienced personally this problem while being student, also while being assistant professor as well. This was the very, very big issue, because no one is discussing laboratory things in detail, and most of our thinking and, critical thinking and clinical skills are depended on the laboratory values, right? We can intervene, we can suggest, we can advise based on what laboratory data is suggesting. We can identify ADR as, based on that only. So lots of time we, write that QT prolongation is an ADR, or rising creatinine is an ADR, or those kind of things. So basically, it all depends on somewhere at laboratory. Right. So that is the reason behind putting this course in front of you. And you know what? Most of us study this lab value during the exam, during the practical exam. I will be very honest with you. Most of us, writing also the lab parameters and laboratory values in our case report forms during our practical exams as well. But in the real clinical practice, lab reports are not just the numbers on the paper. We know that, right? They guides the diagnosis. It is for the guiding diagnosis, right? It is influencing the treatment decisions, all of the treatment decisions, I will say. And sometimes I can say even, the laboratory value decide whether the patient will, live or, dead, right? So those are the very important aspects of our laboratory medicine. So I will say, however, many errors are happening in the healthcare, not because the tests were, done wrongly, but because they were interpreted wrongly. So those are our major concern, because we are here to save people, right? So basically that is our primary thing to look after it, right? So this particularly, this course is designed to bridge this gap, what I am discussing, with you right now. So we will be seeing throughout a week lots of laboratory things. Okay. So I will say, I want to say actually that we are not here to memorize any of the reference ranges. You know it, I know it, and we can remember it later as well. But we are here to understand what exactly a lab value actually means, okay, in the real patient settings, okay, and in front of you. So that is our learning objective for the whole course. We are not here to remember the reference range that the normal sodium level was should be this, normal creatinine should be this. No, okay, because I know that many reference books, even in your practicals and all, you are also going on a ward round and all. So वहां पे आप सीखते ही हो, right? You are learning all those things. We are here to understand the reason. Okay, we are here to understand what it influence, why it influence, and how we as a healthcare professional can intervene. Okay. So throughout this course you will learn how to think clinically, right? How to question abnormal results, and how to correlate those lab findings with the patient's history and the symptoms, that I will guide you, right? So, see, throughout the 7 days, we will be exploring a lot of things. Monday to Monday, this course is all about. Sunday, we will be having break. So, next Monday, we will be having the last module. After that, you will be having short MCQ exam as an assessment part. You need to attend it. You need to, give that MCQ based exam in order to get the certificate. It is compulsory. Okay. Also, your attendance is compulsory. This is the recorded session. Of course, in case of an emergency, if you are not joining, recorded sessions will be available for you. Okay. Uh, Someone is raising question. Yes, screen sharing. I will be briefing you. for next 5 minutes what is coming in the session and what is coming throughout the courses, the whole course, and what is coming in the sessions. And then I will be sharing screen with you for the module number one. Okay. So just listen to me. These are basic instructions for throughout the course. So I hope you guys have idea that the attendance is compulsory. Okay. You must attend all the sessions, and in case of an emergency, you can inform in the group, as well as in case of unavoidable situation also you can text in person as well, right? So basically you need to inform, and this is the recorded session, so of course your attendance is being recorded, right? So understand the sincerity of it, because later I don't want any conflict related to the certificates, right? So let me just give you idea about what is coming in the session today, and then I will share the screen with you and we will go through the PowerPoint presentation. But let me just clarify. We will be starting every session with this oral discussion first. I will be briefing what will be in the slides, why it is important, why we are learning this module, and then I will share the slides. Okay. So I hope it is clear to you and making sense. I hope you guys have a little excitement related to the laboratory, because it is not being discussed in the classrooms, right? So this is very important topic. So guys, today's session is all about the foundation. Let me tell you, I hope you have seen the brochure also. We have different modules related to the different parameters. We will be discussing CBC tomorrow, which is our primary and very important topic. But the session today is foundation. Okay. So if the foundation is strong, your rest of the modules will be very easy to understand, very easy to follow as well. Okay. So tomorrow's session and upcoming ones will be more advanced, I must say. Okay. But they all are dependent on what we understands today, right? So feel free to think clinically, feel free to question. Okay. Silliest questions are welcome. Okay. And imagine the real patients, as we go along. So you need to imagine a lot in case of the laboratory medicine, right? So some scenarios I will discuss, cases I will discuss throughout. You need to imagine that yes, the patient is coming up with these complaints and showing up this laboratory signs, what we will do next. Okay. So these scenarios will be your case examples. By the end of the PPT, I will be having 1 to 2 cases every single day. So we will discuss a lot of things. Okay. So this is clinical mindset. Okay. Building, I can say this session, foundation session is building. Okay. So we are now building the base, right? So this is all about the course and the modules which are coming. Also, I will say I cannot give you access right now to unmute yourself, to turn on your microphone right now, just because you can see here we have 85 participants with us, and also we have 100 plus strength for this particular course, right? So for this is the online session, and I don't want any kind of disturbances in between, right? You can also understand that thing. That's the reason behind not giving you access right now, but at the end, once the session will be over, I will give you access. If you want to speak, you can unmute yourself and talk. If you want to put your queries into the chat box, you can simply write into the chat box. I will be briefing one by one. We will solve every question, every doubt every day. Okay. But at the end of the session, guys, just because we can just avoid the in between disturbances, right? If you have in between any kind of glitches, or because it is online session, those problems are common, so feel free to text in the WhatsApp group as well. The group is for us only, right? So notify there if you have any kind of problem if you face in between, right? So this is right now I think instructions are over. Please be take care. Okay. Be aware and take care of your attendance, guys, because attendance is the very important part, right? So I hope you will take care of it. Okay, so let's begin. I'm just give me a minute. I'm sharing the screen with all of you, and at the end we will discuss a lot of things. Okay, all of your questions, queries, confusion, and all. So just give me a minute. I'm sharing the screen. I hope the screen is visible to you guys. Is it? Yes. Okay. Okay, just give me a minute. I hope it is visible. Okay, okay. See this. This is the title of our lecture number one, module number one, Foundations of Laboratory Medicine and Clinical Correlation. So today we are, starting with the foundation of laboratory medicine. So I want you all to understand one very clear thing from the beginning. This lecture is not about memorizing laboratory values, guys. Okay, so don't have that kind of confusion that we will be discussing about laboratory values, reference ranges for the exams. It is about developing a way of thinking. My learning objective behind putting this course in front of you is very different. It is only, to think clinically, to think critically, to correlate your laboratory values with your clinical condition. Okay, to developed way of thinking is my objective, right? Every single lab report you will see in the future represents a real patient. Okay, please remember this thing. If you understand how to read that story correctly, you will become a safer and more confident healthcare professionals in the future, because this is very important, right? So this lecture will set the base, as I earlier told you, for everything that follows in this, particularly the whole course for 7 days. So listen, not as just student preparing for the exams, but as a future clinical professionals trying to understand the patient, right? So imagine the scenarios in your mind when I'm sharing the cases with you. This is how we can understand laboratory in very detailed manner. Okay, so let's start the session with the learning objectives, guys, because these learning objectives are the very clear directions, very clearly defined, that by the end of this session, it is 7:18 right now. So by the end of this, particularly this particular session, what you will be able to understand, that is the learning objectives. It will show you the clear direction. It will generate a curiosity in your mind. Okay, what is coming in the session, why we are learning this and all. So say this learning objectives, by the end of the particularly this session, by 8:30, I will be saying this learning objectives will be clear in your mind. Okay, so by the end of this session, you will be clearly able to understand the roles of lab medicine in the clinical decision making. Okay, so this is very clear. You should be able to look at a lab report and not feel lost or confused, right? You should be able to understand why this test was ordered. Okay, what is the reason behind it, what an abnormal value could indicate, particularly whether that value could be wrong due to an error, and how urgently it needs attention. This all the things needs to be clear, right? So see this, you will be able to understand the role of medicine in the decision making. You will be also able to identify some of the very popular, very common lab errors. By the end of this session, you will be also able to interpret a little bit about reference ranges and targets. Also, you will be able to recognize critical values. Okay, what is up, what is down, and what is emergency situation. And it is also, you will be having some of the cases for the general things, to understand general things. And it is an introductory case for the interpretation to understand the laboratory medicine. So this is the direction, this is the map for the session today. Okay, so I hope it is clear to you and making sense that what is coming in this session today and why we are learning this. Okay, just a minute. Okay. Okay, so let's start with the laboratory medicine. First, we will understand the definition, of course, but this definition is not going to be asked in the exams or in interviews, right? This is for the general purpose. This is for your general understanding that what does exactly laboratory medicine is all about. So here we have three bullet points to understand laboratory medicine, guys. Okay, see this laboratory medicine is a medical discipline that provides objective data to support the clinical decisions. Okay, I can say it is the medical discipline that is providing some of the objective datas, right? Some of the objective data, some I can say some of the, in particularly units and all, to support the decisions. In fact, all of the clinical decisions are based on this particular data, right? So while, symptoms, physical examination gives us the clues, some of the clues, but laboratory confirms it. Okay, laboratory test confirms, or I can say it is giving you the clear direction, right? So see here, it is an analysis of the body fluids or tissues or cells to understand, and the clinical, to make the clinical decision and to understand the disease progression or the disease itself, right? It is supporting what? Diagnosis, prognosis, also monitoring. So we can understood by seeing the laboratory medicine, that what is the status of the diagnosis, what is the status of the disease, what is the prognosis, and what is the monitoring as well. So you can do a lot of things by looking at the lab report, and you can consider it as a backbone of evidence based medicine, right? Because that's the reason why you can say that if your value is this, yes, you need medicine. If your value suggests this, yes, you need medicine in that case. You can also categorize your disease levels, right? Stages, right? So if I can say, kidney injury, so AKI has different level of laboratory parameters, right? Then CKD has extremely difficult and different type of, it is showing a whole different type of laboratory investigation in front of you. So this is how you can categorize as well. Of course, laboratory medicine uh, show you a lot of things. Okay, let's start with one very common example. So patient may complain of weakness. Just understand the very basic scenario to understand, in detail about laboratory medicine. Imagine a patient, complaining of weakness, but only hemoglobin test can confirm the anemia, right? Extreme weakness, if the patient is having as a chief complaint, only the hemoglobin test can confirm the anemia. So a patient may have fever, but the lab tests help us to identify whether it is bacterial fever, whether it is viral fever, whether it is only an inflammatory condition, right? So in short, I can say lab medicine converts your clinical, suspicion, your guesses into the clinical evidences. Okay, with that you can go forward. Apart from this is all about the diagnosis part, right? But we are not here to diagnose anything, guys. It is a clinician's duty. But why we are learning this? Because it supports everything later. So you need to understand the diagnosis as well. It is your duty to understand, as and for healthcare professionals, if you want to suggest alternative therapy, if you want to recommend it, if you want to recommend something for the better patient care, you need to do analysis, you need to do monitoring, right? So for this reason, you must understand the laboratory medicine. I hope it is clear what and why. Now again, I have one more slide to understand why this lab medicines matters so much to us. So let me give you a practical example to understand why, because I am very sure with this perspective that your why should be very strong to understand the whole course and the modules, right? So let me give you a practical example. See, a patient walks into an emergency department with the chest discomfort. Imagine the scenario. Patient is walking into an emergency department with the chest discomfort. Now, clinical examination may look, normal at first. ECG may be, at a borderline, you can assume, but an elevated troponin only can completely change your management. You need lab medicine in case of an emergency as well, right? So this is how you can correlate a lots of examples to understand this. Okay, and this is why lab medicine directly influence the diagnosis, treatment decisions, and the patient outcomes. Correct. And also I will say it is estimated that nearly about, you can see here, 70% of medical decisions are depend on the lab results, guys. 70% is a huge number. Those decisions made by the lab reports, clinical decisions rely on the labs, right? And you can also understand that early detection and risk stratification is helping in the patient care. Okay, so that alone tells us how critical correct interpretation is. Okay, so this 70 percentage is showing us the importance of learning lab medicine. I hope now you have idea what exactly laboratory medicine is all about, and why exactly it is, holding so much importance to understand. Okay, now let me give you idea. This is the foundation of the whole course. So let me just give you idea about lab medicine across the patient's journey, patient care. So of course, lab tests are not, only used when the patients are sick. Not at all, right? They start much earlier. It is starting much earlier. Screening tests like this, HbA1c or lipid profile that identifies disease before the symptoms appears itself. You can, suggest some of the patients as well, that HbA1c, then the cholesterol profile that can saves big disasters that will happen, that is going to happen in the future. Of course, you can diagnose it, you can, early intervene, based all based on the laboratory reports, right? So during the diagnosis, tests like this cultures, electrolytes, or imaging related markers that confirms what the clinicians suspect later, right? So during the treatment also, lab helps to monitor whether the therapy is working or causing harm. So it is important in screening, of course, it is important in diagnosis, it is important during, also during the treatment. This helps further to monitor whether the therapy is working or causing harm, because the both of it is having the possibility. Okay. And also after monitoring, I can say even during the follow up, even during the follow up cases, lab values gives the idea about the dose adjustment and in the long term care, right? And this is what exactly the role of clinical pharmacist is holding. Prognosis, right? Also prognosis you can check. So lab medicine stays with the patient from the beginning to the end of their healthcare journey, guys. Okay, that is the reason behind why we are learning this course today. And this is the importance the topic is holding, because it is started from screening to prognosis, beginning to end. The whole healthcare journey is depend on the lab medicine. And if you are visiting intensive care units and those areas, you must be aware of this thing. Every day laboratory investigation is compulsory to note down, to perform, okay, to screen, to diagnose, to monitor. Every day it is compulsory. And as a healthcare professional, you must be aware of what is happening in the laboratory medicine and how we can interpret it, right? So now let's connect it with the clinical ways, clinical correlation. So one of the biggest mistakes I will consider in the clinical practice, guys, it is interpreting lab values in the isolation, right? So value that looks abnormal on a paper, the lab value which is looks abnormal on the paper, that may be completely acceptable in a particularly clinical situation. And many times this is happens in the ward round. Okay, many times this is happens with the ward round. Sometimes you will feel in the ward round that clinicians are not taking decisions based on the laboratory values but based on the symptoms. That is also the scenarios. I will be discussing some of the real scenarios in our upcoming sessions in which you will see opposite situations as well. Okay, for an example, slightly low sodium level in the stable patient that may not require urgent treatment, but the same value in patient with altered consciousness, that could be dangerous. So I want you to think in this way, in clinical way, right? In which scenarios is exactly been needed, in which scenarios is won't be needed, right? Because what generally in the the pharmacy people and the pharmacy people understood is, if the low sodium is there, of course the treatment will be needed, right? But it is not like that. It is the simplest example to understand the whole scenario. Guys, please have the broad mindset as we go forward, because many things I will discuss which will be contradictory, right? Which will be opposite of our theoretical understanding, because I will be putting some of the very real cases in front of you, with the link as well, which is published, right? You can see afterwards, you can read afterwards, which cannot, which is not showing any relationship with your laboratory investigation, which what we understood, we understands in the reference books and in our DP row and all. So that may be contradictory. I am just giving you a idea कि ये भी चीजें होगी जो हम डिस्कस करेंगे. So have the broad mindset to understand it. As in, I give you example of the sodium level, right? So you need to understand in which patient it is urgently required and in which patient it is not required. So always ask yourself three questions, guys. Three questions you need to ask. Who is the patient? First of all, means you need to analyze the patient's history and all, and you need to understand the patient. What are their symptoms? You need to understand their whole symptoms and the history. And does the lab value make sense in the context or not? That is the very important question. And by the end of this, particularly the whole course, you will be able to understand these three questions very, very in detail. I will say very, very, clearly you will be able to understand how to solve these three questions. Right. So this is the clinical correlation. Always interpret with the history, symptoms. You need to correlate everything, right? We cannot always rely 100% on the symptoms, guys. Treat the patient, not the numbers. Okay, we don't want to treat numbers as in laboratory things, right? We don't want to, like, for an example, if the patient is suffering from high blood pressure and you are giving some of the medicines to treat antihypertensives, right? You are dispensing or you are providing, you will treat numbers. You need to do the favor to the, of course we are aiming for lowering the blood pressure, but we cannot treat the numbers like it should be 120 by 80. No, right? I need to treat patients perspective. Patient related factors are playing a huge role while making the clinical decisions. I will let you know by the case examples how to think in that sense. Okay, how to think like an how to relate everything and how to think like in clinicians. Okay, so I will be giving you some of the very good example to understand this clinical correlation in our upcoming modules. Now, you need to understand one very basic thing, that is the total testing process first, because this is the foundation. You must be aware of the base. Okay. From tomorrow, we will be having directly the CBC and all, and we will be having a five different modules on the five different laboratory investigation, which are, currently in the practice. I hope you have seen the brochure as well. But this is the foundation. So you must be knowing the total testing process just to understand the lab medicine in more detail. So many patient sorry, many people believe that the lab errors happens only because of the machines or the technicians, guys. Okay, but in reality what happens, laboratory testing is a process. It is a complete whole process which requires skillful persons, right? And it is a process with the multiple steps as well. An error can be occur at any point, right? So the total testing process, that is the TTP, that includes what happens before the sample reaches to the lab. Please understand, this process includes what happens before the sample reaches the lab, what happens during the testing, and what happens after the result is generated. Error can be at any step. So understanding this process will help you to decide whether to trust a result completely or always question it. Okay, so I need to think I want you to think in a very opposite direction as well. What practice you have been doing right now is, I know what you guys are doing is you are seeing the laboratory report, and based on that you are treating or analyzing the case. Think it in an opposite way. You are analyzing the case and relating it with the laboratory thing. Okay. So imagine when you are skillful enough, when you are knowledgeable, when you have lots of skills in you, you can think in an opposite direction, guys. By looking at the symptoms, by looking at the case, by understanding the whole scenarios, you can predict what will be the laboratory value, and then you can correlate, and you will be 90% you will be right in that way. But it requires a lots of experience and skills as well. So understanding this total testing process will help you to decide, to think in an opposite way. Also it will help you to um question that why this laboratory investigation shows such values. Okay, so understand this three very important this total testing process steps: pre-analytical, analytical, and post-analytical. I hope it is clear to you. Pre-analytical means the before it reaches to the lab. Analytical means in the laboratory things, and post-analytical means after the result is being generated. So understand this three different step and the process, so it will give you idea about the errors it can happen. Now, let's understand what is this pre-analytical phase is all about. We will be briefly understanding this three things because we are not deep diving into it because this requires a skillful professionals and we are having it in the healthcare field, right? So we are not diving deep into this particularly this pre-analytical, analytical, and post-analytical things. Just need to understand briefly that these three are the steps before the result, appears on the paper. Okay, so the pre-analytical phase includes everything that happens before the sample is being analyzed by the skillful person. Steps before analysis. Okay, the patient preparation, the sample collection, labeling on it, transport of it, storage of it. I hope you are connecting the dots, right? And imagine the whole scenario. A person who is taking, the lab technician is taking the blood. So, of course, whole scenario, the patient preparation, sample collection, labeling, transport, storage, right? So interestingly, let me tell you guys, studies show that most of the laboratory errors that is occurring in this particular phase, major source of lab errors, not inside the machines, right? So this means many errors are preventable with the proper awareness for this pre-analytical phase. Okay, so you must be aware of this. Now, common some of the pre-analytical errors, what are this? So common errors includes what? Drawing blood from the wrong patient, right? Wrong labeling the sample incorrectly, using the wrong collection tube, or causing the hemolysis by the rough handling, okay? Or, the wrong tube. Even a small mistake like not allowing alcohol to dry before, the vein puncture, that can affect your results. And these errors may look minor, but let me give you idea, it can significantly alter the lab values, and it is happening. Okay, so these are some of the pre-analytical errors. Now understand some of the examples to understand this pre-analytical in detail. So let us take a very common example here. A lab report shows a very high potassium level, very high potassium level. Now, before assuming the patient has true hyperkalemia, always check whether the sample was hemolyzed or not. Okay, don't worry if you are not taking this example or not understanding this example right now, not able to understand this example right now. We will be discussing all those things in our upcoming modules. Simply, right? This is the foundation. So just I'm giving you some of the ideas of error you can find out. Okay, so before assuming that the patient is having a true hyperkalemia, always check whether the sample was hemolyzed or not. So hemolysis releases what? Potassium from the red blood cells into the serum, right? That is what causing a false elevation, guys. So if this is not recognized, the patient may receive what? Unnecessarily, and the treatment, harmful treatment, I will consider. This is why understanding this pre-analytical errors is critical for the patient safety, and you must be aware कि ये चीजें भी हो सकती है. With the reason, अगर आपके पास कोई symptoms नहीं है but still patient's laboratory value showing some abnormal things, you can predict the chances of errors if you know that it could be. Okay, so that is the reason why I have included this. Okay, so you must be aware of this pre-analytical errors. Now, patient preparations error you need to understand because these are, as I earlier told you, these are the major areas where the error can take place. So let us talk about the patient preparation, which is often underestimated. This step is underestimated. Many lab tests are highly sensitive to how and when the sample is being collected. Very important. For example, lipid profile ideally requires what? Fasting, right? And non-fasting samples are being collected. So if the patient eats a heavy meal, what happened? Triglycerides may be, falsely elevated, leading to an incorrect diagnosis, further incorrect treatment as well. Another common issue is drug interference. The second bullet point, drug interference. Certain drugs can alter your liver enzymes, electrolytes, hormone levels, everything. Right. So if we do not know what medicine that patient is taking, we may again misinterpret the results. Timing also matters, which is not written here, but for your understanding, I will be just saying timings are also, having making sense. Cortisol level, for example, cortisol level vary throughout the day, right? Therapeutic drug monitoring requires what? Samples at a specific times if you want to do TDM, right? So a perfectly done lab test can still be misleading if the preparation is wrong. Patient preparation is very important. Now, second phase, this was all about what the pre-analytical, right? Before the sample is reaches to the lab. Now, what happens in the analytical phase, which is also considered as an instrumental. So once the sample reaches to the laboratory, now it enters into the analytical phase, right? Now the actual analysis is being done. So this is where the actual testing happens using what? Using different instruments or reagents or standardized methods, right? Most people trust this phase blindly. We need to, okay? We don't have any option in it, right? So that is the reason why calibration is being taught to us, right? Assuming that machines never make mistakes. While modern labs are highly automated, let me tell you, and also reliable as well, no system is, completely, still no system is completely error free. So understanding that analytical errors can also happen, further help us to remain very alert when the result does not match the clinical picture, guys. And this is the scenarios, and this is where exactly the clinical pharmacist can stand. एंड ये बहुत बार होता है इन द हॉस्पिटल सेटिंग्स इन द वार्ड राउंड्स व्हाइल सीइंग द पेशेंट. बहुत बार ये चीज दिमाग में आती है कि क्लिनिकल पिक्चर कुछ अलग बता रहा है एंड लेबोरेटरी शोइंग सम डिफरेंट थिंग्स. You need to intervene in these cases, right? And trust me, guys, this practice it is done by the clinical pharmacist, in the abroad, out of India. This practice is common, right? If the clinical picture is not matching with the laboratory values, what you will do? You need to intervene that there must be chances of an error in the laboratory things. Okay, you need to question it, and you can. And these are the possibilities. I'm just showing you that these are the possibilities where error can be happen, right? So this is the analytical phase definition. It is an instrument and the reagent testing, and still it is having the chances of an error. So what are the analytical errors that can be? So analytical errors may occur due to some improper calibration of instruments, deterioration of reagent, right? Or technical faults in the analyzer. For an example, just for an understanding, I'm giving you the example. If the machine is not calibrated properly, all the patient results may shift, slightly high or low. And this does not affect just one patient, it affects everyone tested during that period. You can imagine the impact of it, right? So this is very important to make these things very clear. Let me just give you the clear idea that modern labs are very automated and the chances of errors are very low, but still it is happening. So we need to be aware. Okay, we need to be aware, and we must intervene in these cases. So this is why laboratories are following very strict calibration and maintenance schedules as well. Okay, so this is analytical errors. Let me just give you idea about the example so that it will be clear to you. A very practical exam is written here, and it's biotin interference, guys. Drug interference, as I earlier told you. Right. Many patients take biotin supplement for hair and skin without informing clinicians. I must say, right? Many of you might be taking biotin as well. Okay. So high dose of biotin can interfere with the all type of immunoassays and produce falsely low or high hormone levels, okay, especially TSH. So if the patient's lab results do not match their symptoms, always consider analytical interference, drug interference before changing treatment, guys. Okay, so be little bit aware of these things so that you can further identify and improve, okay, in the particularly this area. Now, let me just give you idea about quality control. Now, when we talk about instrument phase, analytical phase, always we must be aware of quality control. Okay. So to prevent, this kind of analytical errors, laboratory use this QC system, that is quality control system. Internal quality control checks are done, daily to ensure machines are working correctly and properly. External quality assurance programs are also done. Okay, to compare the lab results with the another laboratory as well. So if the result, deviate, corrective actions will be taken. So this is internal quality control, and external quality assurance programs, IQC and EQA, are also happening in the laboratory for the corrective action. So this is why results from, accredited labs are generally reliable. But the clinician must still remain alert. Healthcare professional must still remain alert, right? So this is you need to understand this. These are the things happening for the quality control, but still we need to check. Now, the last phase is the post analytical phase. Now, once the testing is complete, the result enters, and the result is completely entering into the post analytical phase. Now, this includes what? Validation, result validation, reporting, communication, and clinical interpretation. Since it is started from reporting to clinical interpretation of it and advice, all considered as a post analytical phase. Now, this phase involves both the laboratory professionals and the clinicians and the healthcare professionals as well. Making communication is very extremely important. Even a perfect test result can cause harm if it is misunderstood or ignored, right? So that is the reason why this phase is also having important uh, you know areas to think. So post-analytical errors includes what? Delayed reporting, right? Very common error. Then transcription mistakes. Very common mistake it is also while entering data into this computer system, while generating PDF. These errors are very common. Or also, the very common is the failure to recognize the clinical importance of a result. Okay, so this is a post analytical error. For an example, I will say critical value, critical value which is very important for the patient treatment, which is further read in a routine report that may be missed if the proper alert systems are not in a place. So it should be there, right? Human interpretation play a major role in this phase, guys. So delays and misinterpretations are the post analytical errors. I have one example also to study this. So imagine a patient with very low blood glucose. Okay, imagine a patient with very low blood glucose. The result is correct, but it is reported late or not communicated urgently. What will happen next? The delay itself can lead to what? Some type of seizure attack, coma, or maybe death also. So this example shows that the timeline is also as important as accuracy in the lab medicine, guys. Okay, so late critical value reporting is the serious error for the post analytical phase. Okay, also you must be knowing the reference ranges. As I earlier told you, we will not going to discuss about reference range, but you must be knowing. Okay, so let me just ask you a very simple question. If a lab report says normal, lab report reference range is showing normal, does that always mean the patient is healthy? What do you say? What do you say? What do you say? No, right? No, exactly, exactly. So even if lab reports reference range is showing, the range is normal, patient may not be healthy, right? Reference ranges are the statistical values, guys, not a magical cutoffs. Let me tell you, they are calculated from a healthy population using some, taking the middle 95% of values. That means 5% of healthy people will fall outside of the range. You must be aware of these fundamental things. Even though nothing is wrong with them, still they falls under this category. Simple analogy to understand this is think of the height in a classroom. Think of height in a classroom, right? Most of the people fall within an average height of 5 to 6 or 5 to 8, right? Someone taller or shorter isn't automatically abnormal, right? Same logic applies to the lab values as well. So the teaching point here is reference ranges, abnormal reference ranges, I will say it is not always the disease, and within normal ranges is not always the health, perfect health. And you must be knowing this concept. Okay, so reference ranges are deriving from the healthy population. 95% of the value, 5% of healthy people will fall outside the range as well, and you must be aware of this concept so that you can question always, and you cannot 100% rely on the what you are seeing. Okay, and I'm very sure out of this 100 people, 90%, 90 people, 90 of you are practicing in this way only, seeing the laboratory and correlating with it the clinical things. And sometime, the question was there in the mind कि ये क्यों मैच नहीं हो रहा है. In that scenario you must be assuming something कि हाँ कुछ और होगा जिसकी वजह से रेफरेंस रेंज abnormal दिख रही है. But it is not like that. There is always a chance of error, and you must be identified. You must be able to identify it at least. Okay, what are the limitations of reference ranges, guys? So now here's where many mistakes happen. Let me tell you. Assuming reference ranges are universal, it is very big issue. They are not. Reference ranges changes based on the what is the age, whether the patient is newborn, adult, elderly. Okay, reference ranges changes as per the age, and from tomorrow we will be discussing special population category of the each of these uh, laboratory medicine, and each of this module we will be having a special population which considers the age and all. Also it is highly depend on the gender, it is depending on the pregnancy status, which is again a special population, ethnicity as well, and lab method and instruments as well. Method dependent limitation is also there. Okay, so just let me just give you a very simple example to understand the limitation. Imagine a hemoglobin of 11.5. A patient is having hemoglobin range 11.5 gram per dl. So it might be normal for a pregnant woman, 11.5. Okay, it is a borderline for an adult female. It should be high. It is abnormal for an adult male. It is low. So if you don't know who the patient is, right? The number alone is meaningless. You must be knowing a patient related factor to understand it, right? Always ask whether it is normal for whom. Okay, and don't remember the ranges. This is very simple example of hemoglobin. Nothing to do it. Nothing to do with it, right? But if I will go in a critical lab values, in that scenarios as well, you must ask it is normal for whom? What is the scenario? Okay. So you must be aware of this reference ranges limitation. Okay. Now let me just discuss reference range pitfalls with you so that it will be clear to you. Now, this slide shows one of the most dangerous lab pitfall, guys. A patient may have normal creatinine. Understand, patient may have normal creatinine but still have poor kidney function. Dangerous. Sounds dangerous, right? Why this is happening? Because creatinine depends on the muscle mass, guys. Creatinine is depend on the muscle mass. Elderly patient, thin patients, malnourished patient produce less creatinine, right? So this is very important to understand that normal creatinine, but low GFR, that is suggesting the whole picture to you, right? So if you are in a third year, fourth year, above it, you can understand this line. If it below, you will not be able to understand this particular sentence. But for now, see, we will be discussing RFT, renal function test, and all kidney function test and all in detail about our upcoming modules. So if you are not able to understand right now, do not worry. This is just an example to show the pitfalls are in the reference range. I will be elaborating each of the points of this foundation in very detail in our upcoming modules. Okay, so never interpret creatinine alone, guys. Always look at GFR. Okay, you must correlate with these things. Now, what are the clinical targets? So now let's shift from the reference ranges to something more practical, and that is the clinical targets. Okay, clinical targets are the goal values, what we have goal in our mind, and it is outcome based goals. Okay, so clinical targets are the goal values decided based on the research and outcomes. So difference is clearly stated, guys. Reference range is what's common in the healthy people. Okay, while clinical target is what improves the patient outcomes particularly. So this is where lab medicine truly meets the clinical medicine, right? So we need to correlate everything, and we want to have normal range of laboratory things in the patient. That is what our target is all about. See, here I have one example also to understand the clinical target. So let's look at some familiar examples so that you can understand it in a better way. Reference range might go up to, I can say, 5.6, but diabetic patients are targeted to stay below 7. I'm talking about HbA1c. Okay, reference range might go up to what? 5.6, but diabetic patients are targeted to stay below 7. Not because it is normal, but because it reduces the complication. That is what our target is in the diabetic patient, right? For example, in LDL cholesterol, a heart attack patient may need LDL, I can say, less than 70 mg per dl, right? Much lower than the जनरल पॉपुलेशन गाइस, जिसको हार्ट अटैक का रिस्क होता है, उन वाले कंडीशन के लिए हमें एलडीएल बहुत ज्यादा कम रेंज में चाहिए एज कंपेयर टू द जनरल पॉपुलेशन, right? I will give you idea when we will be going to discuss the module of this lipid profile. why, and how. Okay, how to correlate. Everything we will discuss. This is one of my favorite topic to discuss all the time. So don't worry, but understand this clinical target. Okay, what we need to achieve. Like for example, INR for warfarin patient, this INR ratio that 1.0 that is normal, but clinically it is useless. We need to, they need INR between 2 to 3 clinically. But in warfarin patient, if the patient is taking warfarin, we need 1, right? So clinical targets are the patient specific, guys. It is not population based. Patient specific means we need to consider the factors related to patient factors, right? So this is the clinical target scenarios. I am just briefing you about how to think, what to think, okay, while learning lab medicine. Now, critical values we need to understand. So now come to the most urgent category. These are the values, these are the results that indicating a life-threatening situations. Or and I can say it requires an immediate action. Life-threatening results, it requires immediate action, right? So when the lab detects a critical value, okay, they must call the clinicians as soon as possible, not just to upload a report, but they need to inform. As I earlier told you, severe hypoglycemic episode, right? So they need to inform. In critical values, minutes can mean life or death, guys. So you must be aware of the critical values. Okay, sometime while working as a clinical pharmacist, you will be having this experience. How exactly we need to um, how exactly we need to respond in these scenarios. Some common critical values, let me just give you idea about some critical values you must memorize as an healthcare professionals. For example, potassium is too high, so it can lead to what? Fatal, arrhythmia cases. Potassium, right? Glucose, if it is severely low, it can result in anything, seizure, brain damage, or coma, death. Hemoglobin, for example, very low, hypoxia can be there, right? These are some of the critical values you must be aware of. So would you wait till morning to treat patient if the patient is having potassium, very high? What, would you wait till morning? No, of course no, right? So this is how the critical values needs to be treated, right? This is an emergency medicine. Okay, now you must be also aware in the foundation red flags versus the critical values. There is also red flag and there is also critical value. There is a thin line difference between these two. Okay, not all the dangerous situation come as a dramatic number, guys. Okay, some patient deteriorate slowly. Lab gives us early warnings as well, and these are red flags. So critical values is immediate danger, of course, but red flag is a warning sign, guys. Okay, so good healthcare professionals don't wait for the critical values. Hmm? So you need to understand red flag versus critical value. Okay, we have example to understand it. Red flag example, you can just have idea. Let's say a patient is patient's creatinine. Again, we will be having example of rising creatinine that goes up to 1, then 1.3, then 1.6, then 1.9. Okay, so each value might still be normal, near to normal, but the trend is alarming. If it is in increasing in manner, it is an alarming situation. So trend speaks louder than the signal values. Red flags are also considered coming emergency, future emergency, right? So we need to treat this thing too. Importance of trends. This is the trend I was talking about. Trend means pattern, guys. Pattern. Okay, a single lab value is like a photograph you can consider, but a trend is like a video. So you can see it is growing, it is rising, it is declining. What is happening? Okay, so trends or a pattern help us to detect early disease, to monitor the treatment response, whether the patient is responding to our treatment or not, and to identify the worsening conditions as well. Okay, for example, I can say here you can imagine the rising creatinine, right? One report is showing 1.1.0, second report 1.3, third report 1.6, fourth report 1.9. So it is a trend, right? So trend is pattern, right? So you must be aware of it. Now I have one case-based interpretation to understand, okay, everything all together. So let's put everything together, whatever we have seen this in this in this particular module. So when you see a lab report, don't panic. Follow this stepwise approach I am telling you. First, we need to understand the abnormal values. And also your professors and all are suggesting you to write in the case report form the abnormal lab values so that you can correlate everything all together. Second, classify the problem. You need to classify the problem. The chief complaints patient is suffering from. Correlate it clinically. If the patient is telling you that if he or she is suffering from certain symptoms and the lab report is showing some abnormal things, you can correlate clinically, and then you can lastly decide the next step. This is how the real healthcare professionals or clinicians are thinking. Okay, identifying abnormal value, classify the problem, correlate clinically, and decide the next step. Okay, this is a stepwise approach. Okay, now I have one of the case to discuss with you. See this case. Here, the patient is 45-year-old. The chief complaint is fatigue. Here's our first case. You can see here, 45-year-old, focus on the age. Fatigue is the chief complaint. Hemoglobin is 9. Clearly, it is low. MCV, it is a 70 femtoliter. It is showing a microcytic anemia condition. Okay. Mean corpuscular volume, it is showing the size. Okay. 70 femtometer. It is commonly normal range. I hope you guys have idea. It is having 100, right? 80, 100. This is the microcytic case. Okay. But first question, is this anemia or not? Is this anemia? If the normal hemoglobin adult range is 13 to 17 and your patient is having 9, it is a moderate anemia case. Second question, what type of anemia it is? So if your MCV is below 80, it will show you microcytic anemia. So this immediately narrows the differential, right? Always classify anemia by MCV first, not by guessing the causes. I will be discussing anemia also in detail, so do not worry. If you have understood the anemia pathophysiology things, it must be clear to you the case, right? But in this case, you just have, see, this is a very simple case I have put to understand and correlate all together. The step I have been telling you in this stepwise approach, you need to understand what is abnormal in this case. So of course we can see here the hemoglobin and MCV is abnormal. Now we need to think that patient is having fatigue. Of course we are clinically relating the whole scenarios, right? Then we are identifying the cause and then correlating it with the symptoms, and finally we are going forward with the diagnosis. Of course it is a microcytic anemia case, moderate anemia case. Okay, so case one interpretation, microcytic anemia. Why it is microcytic? Because it is showing a low hemoglobin plus low MCV, that is a small pale RBCs, indicating impaired hemoglobin synthesis altogether. What kind of common causes it can have? Of course, iron deficiency anemia, it is the most common one. Anemia of chronic diseases, that can be also the factor. In this, if you want to decide between these two, the causes, you need to ask the patient. You need to check the patient's history. You need to do a counseling. Okay, you need to talk with them so that by that you can understand what kind of anemia the patient is having. Of course, iron lab test, the ferritin level is also giving you idea about whether it is iron deficiency anemia or not. Okay, why not jump to the treatment yet? Because the lab numbers don't tell the full story. Giving iron blindly can be harmful if the diagnosis is wrong. That's the reason I have not put the treatment here. So you can imagine, you can think what can be the next steps. Okay, what can be the next steps? You need to understand how, whether it is the iron deficiency, whether it is the anemia of chronic disease. Based on that, the treatment will be decided. Okay, but first this is the process now. So the next steps will be what? Explain why. So serum ferritin, of course we need to check this whether the common cause is iron or no. So we need to check serum ferritin. If it is low, iron deficiency. If it is not, it will be chronic disease. So iron studies, of course, serum iron, TIBC, and transference situation we need to check. So clinical pearl here is anemia is a diagnosis, guys. The cause of anemia is the real problem. And we need to understand in laboratory medicine how exactly we need to correlate what type of anemia a patient is having. Okay, very important and very directional the anemia's treatment approach is, right? Now, the case two, for your understanding, for your better understanding, see here, the case is from ICU. The case one was very simple, very basic, right? Case two is something on an advanced level. It is an intensive care unit patient. Potassium is 6.8. You can see here the normal range. It is higher. ECG changes are also present. What is immediate interpretation? This is called severe hyperkalemia. Okay, potassium is very high. As I earlier told you, in the critical situation, potassium is high. You need to treat it immediately. Okay, so any potassium is greater than 6.5 is potential life threatening situation, guys. Okay, and why ECG matters in this case? Because ECG changes confirm the physiological impact, not just the lab number. So you need to check the T waves, the QRS, and all, right? So potassium value plus ECG, medical emergency, not a discussion point here, right? So basically, यहाँ पे कोई भी treatment approach नहीं आएगा directly. It will be an emergency case. Of course, the patient is admitted in the ICU itself. Okay, so what is the interpretation? यहाँ पे you need to check if the patient is having a higher potassium. See here, the potassium is high. You need to directly ask that whether it is a true or whether it is a pseudo hyperkalemia. Because when it is case of hyperkalemia, there may be a chances when the two of the possibilities, whether it is pseudo or whether it is true. Pseudo means due to pre-analytical errors. I hope now you have idea what is pre-analytical errors, right? Before the sample is going to the lab, the handling errors are happening. Hemolysis during blood draw, prolonged that tonic use, rough handling of sample, potassium leaks out of RBCs, patients may be asymptomatic, ECG usually normal. This kind of things are happens due to pseudo. Pseudo means it is happening because of some of the errors or some of the uh, some other situation. While true hyperkalemia is actual excess potassium in the blood. Okay, and common causes are acute chronic kidney failure, drugs. Okay, medicine itself is inducing this situation, tissue breakdown. Okay, rhabdomyolysis. These are the scenarios indicating the true hyperkalemia. So we need to understand whether the case is true or pseudo hyperkalemia. Why intermediate action is required? Because risk of sudden cardiac arrest is very high in this case. Patient is already admitted in the ICU. And you can see here, any potassium greater than 6.5 is a life-threatening situation. ECG भी हमारे पास होना चाहिए. So risk of sudden cardiac arrest will be there. Treatment should not wait for repeat test if the ECG changes are present. If the ECG changes are present. Imagine the whole different scenario here. If potassium is high, ECG changes are not present, then what will happen? It is the case of, it might be the case of pseudo hyperkalemia. In that scenarios, test again, again the test will be recommended. So when the potassium is high and ECG is abnormal, first thing we require, that is the intervention, the treatment, and not investigation, right? But if the opposite scenario is there, you must be thinking of pseudo or true, because error chances बहुत ज्यादा होते हैं. Okay, and that's the to understand this case, I started with this error things. Okay, so you can ask yourself if it is not matching with the clinical picture, that yes, this can be the possibilities, right? I hope it is clear to you and making sense now, and you can now correlate and connect all the things whatever we have been discussing since the beginning, right? So here it is a key takeaway. So let's summarize the learning. Labs guides the decision, but do not replace the judgment. Errors can occur at every phase, and always we need to correlate clinically, right? Also, points which are not written here, but you need to understand, trends also matter, the pattern is also matter, so you need to do follow up regularly. Clinical correlation is non-negotiable, I will say. So numbers don't treat the patients, guys. Okay, healthcare professionals are doing it, and you need to understand this in very detail, that chances of errors are always there. Okay, so now we are open for discussion and question and answer. This is one of my favorite time of the whole session. Just give me a minute and I will be back. Till then, if you have any question, doubt, confusion, you can simply put it into the chat box. If you want to unmute, raise your hand. I will be giving you the access also. Okay, just give me a minute. Okay, so we can solve your confusion, queries, doubts. I can see one, two, three questions. Okay, very first question I can see here. What it is, if we can drink creatine from outside, it can affect the kidneys. So in healthy individuals with the normal kidney functions, no, I will say no, because no proven kidney damage has been shown in the multiple, long term studies, I will say, because many questions are involved related to these things, right? Creatine is converted into the creatinine, which is filtered by the kidneys. So this can raise the levels slightly, but that does not mean the kidney injury. Okay, it is a slight effect, not an organ damage. Okay, next question. What would be the therapy approach for life-threatening hyperkalemia in ICU? Okay, very good question, first of all. So, see, very first approach will be the immediate assessment. Okay, so we need to do, first of all, we need to check the potassium level. Of course, it is, if it is a life-threatening condition, it will be more than 6.5. We need to check ECG, if it whether there is a peak T wave or widen the QRS, that we need to check. We need to also check continuously the potassium, renal failure and acidosis. We need to also check. Treatment approach include, first thing is this assessment. Second thing we need to do is stabilizing the, cardiac things. So we can actually give IV calcium. That does not lower the potassium, but it prevents the arrhythmias. So the treatment approach includes IV calcium gluconate 10% and calcium chloride 10%. That can be first your treatment approach. If the ECG is abnormal, calcium is mandatory in that scenarios. And second, you need to check that shift of potassium into the, what is the range and how it is shifting. So insulin plus glucose is also most effective in these scenarios. Okay, regular insulin 10 units IV and 25% glucose. That is the scenario. Also, with that, beta 2 agonist can be the treatment approach. Apart from that, I can say sodium bicarbonate. Okay, if there is the case of acidosis, right? Sodium bicarbonate is also the option. In case of an hypertension, of course, loop diuretics, potassium binders. Okay, these are the treatment options for this. I hope it is clear to you. Okay. Uh, I hope it is clear to you, and that what would be the therapy approach. In fact, we will be discussing this therapy approach in our every module, so don't worry. I will be taking this because lab medicine, we need to correlate with the clinical things, right? We need to correlate it with therapy every time. So I will be discussing therapeutics. Don't worry. Next questions. Should Keshav still be continued if the lab reports are coming normal as of now, or should it continue till borderline high if the patient previously had hypokalemia? We need to understand a whole scenario in this particular case. Okay, so you need to check that what is the exact scenarios, because this is the question, depend on the whole case history, patient related factors and all. So you cannot decide on one single line that whether you need to continue or not. Assessment ongoing potassium losses, you need to do the related to the whole case, right? If the medication history was not collected appropriately, then how come we will know that the patient abnormal laboratory parameters are because of the disease or because of the supplement? That is the chances of error that can be happen. No, but you cannot assume the things. But what I need to tell you is, I need to show you the path to think it in a opposite direction. That these can be the chances, or यही नहीं हो रहा है, right? When I was working as an assistant professor, when I was student myself, I was feeling these things, right? Because when we are looking at the laboratory values, we always think in that sense ki कुछ हमारे जजमेंट में प्रॉब्लम होगा, अदरवाइज लैब टेस्ट कैन नॉट बी फॉल्स, राइट? एंड वी आर नॉट raising any questions towards it. That's what I need to change. I want to change the mindset, and that is what our learning objective is all about, right? Of course, you cannot assume, but you can always think in an opposite way to understand it in a better situation, right? After the course completion, any case module will be given. What exactly do you want in the case module? I will be considering this if you want anything special in the case module. Potassium binds Sagers and also NAP stimulant can be given, right? Yes, of course, yes. If lab values alone can't define a disease, then how do we decide diagnosis when patient symptoms and lab reports don't match? That's where exactly, that's where exactly the whole knowledge of pharmacology, therapeutics, and whole knowledge of microbiology come all together to decide what exactly is happening, why exactly it is happening, right? You need to correlate, you need to connect all the connect all the dots. Apart from the potassium level, but it require by the experience, it is easy, not that hard, until and unless you are facing many rare cases in front of you. Apart from the potassium level, glucose level, and the HB values, what are the critical important values that needs immediate action? I will be telling you this thing. I think you have seen the brochure or no, I don't know, but our brochure clearly has all the things. This is only the foundation course, guys. That's the reason I have been discussing the some general things. See, lecture number 2 is on CBC. We will be discussing lots of things, what can be done, what cannot be done. Lecture number 3 will be liver function test, 4 will be on RFT, 5th will be on microbiology report and antimicrobial interpretation, and 6th will be on biomarkers, and 7th will be on oncology markers. So major areas we have been taking throughout our whole week. Okay? Don't rush, step by step everything will be clear. I have seen a patient admitted for an tibia. At the time her HbA1c is 9 and she was discharged. Then after 10 days, she was admitted for infection at the site. That time also they taken HbA1c at the time it was 6.7. She was an injection start during discharge. What's the possible error? See, here can be very important thing you need to monitor here is what is the reason behind this fluctuation, right? That you need to check because it is a drastic change, right? It is a drastic change. So you need to intervene into the case scenarios and you need to advise also the patient in the scenarios that this is happening. So they must be re-intervene or they must be going for the recheck if possible. Are there cases where lab results mislead? Yes, of course. I will be putting lots of cases in front of you in our upcoming modules. Specific, whatever modules we are learning, specifically those cases I will be putting in front of you to understand it. And those are real. I will be putting link also for published cases it is where the lab reports are mislead the diagnosis. And also I will be putting the cases where clinical pharmacists in abroad doing intervene and doing the whole intervention in between and preventing the errors. And I want you all to become like that. Then we can ask for the good pay, right? Good salaries. Of course, our tasks should be as important. Okay, any more questions, guys? See, we have our WhatsApp group as well, right? Feel free to drop message, query, doubts in the groups as well if you have any. Okay. This is recorded session. In case of an emergency, you can have it, right? After seeing this recorded session, also if you have doubt, you can put into the chat box. I am just a message away, right? You can simply put the message in person as well if you have any doubt. Okay. See you guys tomorrow, same timing. Everything will be in the group. Link will be in the group. Okay. Okay. If no questions are there, we can wind up for today. See you guys tomorrow. Thank you so much for joining today. Thank you. Attendance forms, this is the recorded session, so already it is being taken, but will be shared to by from tomorrow. Thank you so much. Thank you.